speaking of the fiscal cliff, as the U.S. races toward it, some Republicans say they'll walk back on their pledge never to raise taxes. But they want real spending cuts in return, of course. And one big reform that might pave the way for an agreement is raising the Medicare eligibility age. Louise Radnofsky has the story about how that might be easier, made easier by President Obama's Affordable Care Act. Louise, good morning.
Good morning.
So how does the Affordable Care Act make it easier potentially to raise the eligibility age for Medicare recipients above age 65?
Well, it makes it easier. It also makes it harder, so bear with me here. It makes it easier because it includes requirements that people can't be discriminated against when buying insurance because of their medical history, and that older people can only pay 3 times as much as younger people. There's a cap on that for the first time. So before, the concern used to be that potentially millions of people in their mid-60s would be locked out of the insurance market. Now people who want to raise the eligibility age can point to this and say, look, there are other ways of them getting coverage.
Okay, but there are opponents who say that while they could get private coverage, that will basically raise insurance rates, premiums for younger folks?
For everyone. It would be probably more expensive for the older people to be in the exchanges than in Medicare, which probably wouldn't make them happy. But because of this age rating, their premiums being tied to the cost of, for example, those of a 26-year-old, the premiums could go up across the board by 3%. And specifically for the younger folks, the premiums could go up as 8%. Now, the Obama administration has a lot at stake in making sure that these new exchanges work. And it really does seem like an open question as to whether they would be willing to risk that.
Mm-hmm. Now, Medicare, we should kind of walk people through why this is so important. Of course, Medicare spending as a percentage of total federal outlays is both huge and expected to keep growing at a big rate, largely thanks to rising healthcare costs. Now, what if we did raise the eligibility age from 65 to 67? What kind of savings and over what time period would we achieve?
It really depends on how quickly you do it. Under most proposals to change this, it wouldn't happen overnight. You'd probably have incremental changes of a couple of months. And so people who are turning 65 soon probably wouldn't be waiting a full 2 years. They'd just been waiting maybe two to 4 months. And so that time frame is really important in the savings. But if you did it gradually over 2012 to 2021, I think the CBO found that you could probably get about $148 billion in savings to Medicare, but you'd probably lose a quarter of those to other areas of federal spending that would have to grow. And there would be cost increases elsewhere, in specifically health costs to other people, which is why it's a really difficult one for the administration to contemplate doing.
Okay, and by the way, so that $148 billion, which would be offset in part, is that over the 10 years?
That would be over the 10 years because you'd be raising it gradually. If you did it overnight, you could probably get bigger savings.
So what's interesting is even though it would probably be very hard politically to do this, it doesn't sound like the savings really would make that much of a dent in the deficit.
Well, again, that's probably because you're doing it gradually, and overnight you could make a big chunk of savings. It's probably a lot bigger than some of the other proposals that are on the table. Again, when you're looking at Medicare, there's a lot of money potentially that negotiators could go after there. And this is one that they can argue is fairly simple to do. They can point to rising life expectancies. They can really show that this is something that wouldn't be that much of a hardship to a lot of people. But again, the question is whether they're ready to risk the federal health overhaul succeeding for it.
Now, speaking of rising life expectancies, is just one question I've always had is why don't they index the eligibility age to life expectancy?
That's another proposal that sometimes comes up. It's not dissimilar to this idea, whereby you basically raise it by a couple of years, taking into account the rising life expectancy. But you could directly index them, and it would work about the same way. It's certainly a significant change since 1965 when the Medicare program was set up. It also remains sort of almost a touchstone in American politics that the eligibility age has never been changed in the 4 decades and plus since then. Now, there's probably a reason that is the case. It's obviously something that is politically difficult to do.
Which is why I think that indexing it would at least take it out of, they wouldn't have to vote on it every 20 years or so. It would just happen automatically. Louise Radnofsky, thank you so much for joining us this morning.